I think the story that stuck with me, it was maybe the first week I volunteered here, this lady called. She said, I have been working since I'm 16 years old. I have worked, I've paid my taxes, I owned my home. I got sick, I had to have an operation, I came back, my job was gone, my insurance was gone. And she said, I am sleeping on a friend's couch. And I have worked all my life. So that's why we're here.
My name is Maureen Tomaszuk, and I am the President and CEO of Community Volunteers in Medicine. CVIM is celebrating its 15th anniversary of serving Chester County, providing access to health care for those people who have no insurance and have no other else to go.
I think our community's under a lot of stress. We have a lot of good people that have lost their jobs, lost their insurance, and a lot of people working still can't afford insurance.
I feel that everyone is entitled to really good health care, and we haven't achieved that yet.
CVIM is important to the community because it is providing a very necessary medical service that is providing health care for those that cannot afford it and who are unable to obtain it elsewhere.
I am proud to be involved with CVIM because no matter where I go in the community, when I say Tuesday is my day at CVIM, people know what those initials stand for. Oh, Community Volunteers in Medicine. That is a great place.
At CVIM, there's a sense of family, a sense of caring, a sense of compassion. All those physicians that I've known for all these years just take great pride in serving the patients well.
It's such a great, worthy cause. We've sponsored CVIM events, I think, for 6 and 7 years, something like that.
CVIM relies on the time, talent, and treasure of all of the community in Chester County. We are very fortunate to have been blessed by wonderful donors who have made this possible. Truly, CVIM's most treasured resource is our volunteers.
I think that there's a need to give back, and I think that's what we're doing. We're helping those who were less fortunate than we are.
It's hard not to want to give and help and support an organization that contributes so much to our community.
Until you have experienced the rewards that you get from volunteering, I don't think you realize that you get back so much more than you give.
When you open the front doors at CVIM and see the grateful patients waiting for either a medical appointment or a dental appointment, they're just so filled with appreciation of the services they receive.
When I came out and visited CVIM and saw the impact on the community that the volunteers have, it blew me away.
We need to be here for them, to provide them with medical care.
The people really need this, and I think what CVIM is doing is it's bringing that great mission, the volunteers, and giving people a break.
I've run over 4,000 physician practices in my life, and I've never seen primary care delivered better than it is done at CVIM.
I think you see a lot of teamwork, you see a lot of camaraderie, you see people putting their heart and soul into making it work, and I think it shows a dedication. And probably more important, shows the sustainability. This isn't a flash in the pan after 15 years, nothing but upward trajectory in the future.
I always say it's probably the happiest job that I've ever had.
I just especially love the people that I work with.
I love to see good people taking care of good people in need.
This is absolutely a top-notch facility, and it's one that receives well-deserved accolades every year.
I was surprised to hear that it was 100% philanthropically funded, and I was simply amazed. I fell in love with the mission, and I fell in love with the volunteers and all the folks that work there.
If I could say one thing to the volunteers from my heart, it would be that we're thrilled to salute and honor each and every one of you.
On behalf of all of the patients who have received care for 15 years at CVIM, I thank each and every one of our volunteers and community partners. Thank you very much for serving the community.